Considering that respiratory disease is our highest incidence disease in the feedlot, and it's the disease which is also perhaps the most difficult to detect in its early stages, what we're looking for is cattle that are showing depression and lethargy. Now, in terms of scientific papers and research, we have a definition of respiratory disease, BRD, which conforms to cattle that are showing one or more of the signs of breathing difficulty, depression, lethargy, and oral and/or nasal discharge. The single most important factor to treatment success is to find those cattle early in the disease course, far more so than particular choice of antibiotic or treatment regimen. We've got to find them early. Now, that means that in most cases, if we're going to get those cattle very early in the disease, we're generally only finding cattle that are showing signs of depression and lethargy. They may have no other signs. So that's where it's really important to be able to pick the animal that's just a bit flat and depressed and off on his own from the other mob. They're the cattle we've got to find at that stage and treat them early.
If pen riders have a really good handle on animal behaviour, what they'll see what we're hoping that they see are the very first stages of respiratory disease. And pretty much what that as simply can be defined by depression. Cattle show the first early signs of depression, and that will be that they're less interested in their surroundings, they're not moving with purpose, they're starting to sort of have some signs that go along with being sleepy or dozy. They're starting to hang their head a little bit, their ears are starting to come down, their ears aren't paying attention as much. Normally cattle that are grazing in the paddock or in the feedlot, their ears will be working the whole time, looking forward and back. They'll also start to get a bit heavy in the eyelids also, and then this will all move on to sort of transgress up to cattle are starting to drag their feet, starting to hang their head really low, and it's usually at an advanced stage of respiratory disease before you actually start to see the respiratory signs, such as increased respiration rates, wet productive coughs rather than dry raspy coughs. And you actually might be able to sort of hear wheezing and all that as well. When you see those signs, it's actually quite advanced in respiratory disease. But what we want pen riders to see is those first signs of depression.
Let's now take a look at an example of spotting an animal showing early signs of BRD.
But he does have a bit of drooling and a nasal discharge, and he's cleaning out his nostrils a hell of a lot. He does have signs of respiratory tract infection, looking at the way he's cleaning out his nose so constantly. When they get really sick, they stop cleaning out their nose, and you get that number 11s, really snotty cattle that don't clean themselves up properly. His eyes are very slightly sunken, and he's just a little bit flat and lethargic. So we'll pull him as a really early pull. Very early signs of BRD. Just a little bit of depression and lethargy, and a nasal discharge, a bit of drooling. But he's a big, fit animal, and he's been identified very early, courtesy of a very astute stocky, and he will respond well to treatment. If we only find the really sick ones with their heads down and their eyes sunken and they're hollow, our case fatality rate starts to climb. So the number or the proportion of cattle that we treat that don't respond to treatment will then start to rapidly climb. The single most important factor to treatment success is early identification.
If an animal with BRD is not detected early and given appropriate treatment, it may not respond to treatment and need to be culled.
So the presentation here is a very severe case of bovine respiratory disease. The clinical signs, if we just sort of go back to the pathology, if enough physical, nutritional, psychological or other stress goes on in the adaptation process of cattle to feedlots, and if their immune systems are compromised enough, they will fall victim to respiratory disease. The viruses and the bacteria involved are not resident in the feedlot that the cattle are feeding on. They are actually natural viruses, if you like, in the noses and throats of the other cattle in the feedlot. Just in some cases, the immune system can't cope with the challenge that occurs when a lot of cattle from different sources of origin are put in close quarters. The extension of that viral challenge results in the bacteria, the normal resident bacteria of the nose and throat, extending down into the lungs and pretty much giving you a clinical picture like we've got here, whereby those bacteria have multiplied in great numbers down in the lungs and the lower respiratory tract, and it's a great environment for those to take off and to actually obliterate the tissue that they're resident in. Temperature rises as the bacterial multiplication process goes on, and as these bacteria move into the blood and spread around the whole body. In the case of when that stage occurs, when the bacteria have actually have damaged a significant proportion of the lung and they're actually into the bloodstream, you get the signs of depression, which we've got with this steer right here, which is pretty much the carriage of the head. The central depression is also manifest by closed eyes, low carriage of the head. The ears tend to get sort of horizontal and floppy. There's pretty much a relinquishing of all the sort of natural prey animal behaviour, whereby trying to evade the threat in front of them, trying to sort of hide amongst the group, having enough sort of wherewithal to sort of get away and to sort of mask those clinical signs. Once we've sort of gone through that stage, we're getting to sort of end stage, which we have here, that infections become overwhelming, and even their natural instinct, their natural behaviour has left them, and these guys are pretty much just looking for a place to lie down and depart. The respiration rate has gone up quickly in this deer, probably because there's only a small amount of lung that's actually operating in him. So he's also got the signs of sepsis and the depression that goes with that, but it's also hard for this guy to take in any oxygen, probably only operating on about 10% of his normal lung. The breathing rate is something that comes after the early signs of depression, and if you can sort of wind the clock back many days before the clinical picture we have in front of us here, there would have been just more subtle signs of depression, so more subtle signs of low head carriage, heavy eyelids, sort of less interest in surroundings, less normal sort of prey animal behaviour. Usually when these cattle move, they don't move with as much purpose as their healthy mates. There might be a little bit of dragging of the feet, but certainly there's a lot of evasive behaviour, such as hiding behind other healthy animals. But the signs of depression are a lot more subtle than this. This is pretty much end stage, and this is a treatment failure here.